Three industry heavy hitters are joining us today to talk about the pre-nuptials for responsible innovation. Find out the latest on a new special purpose acquisition company that will identify organizations that have high growth potential and expanding total addressable markets and are led by mission driven CEOs committed to responsible innovation. Please welcome Dr. Jennifer Snyder, Dr. Stephen Glasgow, and Hemant Taneja.
Welcome, and thank you for joining us for the talk titled The Pre-Nuptials of Responsible Innovation. I'm Dr. Jennifer Schneider. I'm the former president of Livongo and currently an executive in residence at General Catalyst. And I have the distinct privilege and honor to be a moderator/referee with two well-known innovators within the healthcare ecosystem, Hemant Taneja and Dr. Steve Glasgow. I'll let these two gentlemen introduce themselves. Dr. Glasgow?
Well, I've been around longer than Hemant, so I'll try to really abbreviate what I've done. But as it relates to this piece, I think the pieces that I'm most proud of is that I've spent a good part of my career after I delivered about 2,500 babies around thinking about what's going to be obvious 10 years from now and how can we do it today. And that led to things when I was at University of South Florida of creating one of the first true assessment of technical and teamwork competence centers, to literally doing a medical school where we chose students based on self-awareness, empathy, communication skills, and cultural competence. And since I've been at Jefferson, we've really taken a 196-year-old academic medical center and said, what if we actually acted like a startup company? And I think that's what led to a lot of what we've done. We created a 4-pillar model, the old math of academic and clinical, and the new math of innovation and strategic partnerships and philanthropy. And we've looked at digital transformation, not as a hobby, but actually as this is where healthcare is going, let's lead it. So I probably end with this, that none of this is all that original. My bar mitzvah, if you will, was getting a chance to work at what was then called Apple Computer as the head of the advisory board for when they were looking at getting into education and healthcare about 20 years ago. We led the first digital health conference for Apple. And it made me understand the genius of literally, hey, if computers and operating systems are what's happening today, what's going to happen 10 years from now? And I think everything that you'll hear about that Jefferson and Hemant and Livongo and you and Glenn are doing together is really based on that philosophy.
Yeah, I'm Hemant Taneja, as Jenny said. I'm the managing partner at General Catalyst. We are an investment firm in Silicon Valley, and we invest globally, and our mission is to invest in positive, powerful change that endures. And one of the areas we're heavily focused on, for obvious reasons right now, is around the transformation in the healthcare space. And we'll talk a lot more about that in a bit.
Super. So these are our radical collaborators, and they're radical not only because of their difference in fashion. Steve has a closet that would make most fashionistas very jealous, and HT is known for wearing the sporting the vest of the company that he's currently actively working with. Today, we're going to talk about radical collaboration. We're going to talk about health assurance, and I'm going to have a chance to ask both HT and Steve how they see the future of connected care, and ask them for advice on how to succeed in this brave new world. So let's start here. Since the title of the talk is The Pre-Nuptials of Radical Innovation, how did you two meet?
Well, yeah, so it's really probably a good title because we sort of met in a weird way in that Hemant was looking to get leaders together. He had just written a book called Unscaled about his experience with things like Airbnb and Warby Parker and Stripe, which was all about the new economy. If you want to build a bigger, better hotel system, is not building any hotels, but bringing people together. And then Jen, obviously, as you were very involved with the very successful Livongo of, hey, I got an idea. What if we don't treat diabetic patients as patients, but as people that would like to be able to thrive without healthcare getting in the way? So he had brought into a HIMSS meeting in Las Vegas about 15 people. I think I was the 16th person of 15 people that he brought in because he really wasn't sure where I was at. And our first glass of wine was, people told me I have to talk to you, but you've gone from 2 hospitals to 18 hospitals, which seems like the opposite of the thesis of my book called Unscaled. You're really scaling. But everything you talk about is healthcare at any address, which is exactly what I'm talking about. So I have no idea how you're going to get from here to there. And I think the prenuptial piece came to this. He said, we sat together after a couple of whiteboard sessions. Well, what if we didn't just have this distributed relationship? What if a Silicon Valley entrepreneur and a CEO of a 196-year-old academic medical center sort of walked into this bar, had this drink, eventually got married, and had a kid? What would that kid look like where 23 of the chromosomes were move fast and break things, and 23 of the chromosomes were around a mission, around research, education, and discovery? And that's what we started working on. And we, in many cases, have created that kid. And the prenuptial piece, Jennifer, came, I think, a little further along when we said, yeah, but, and there's a big but here, we want to make sure that everything we're doing is not just making the wealthy healthier. We want to make sure that for the first time, this revolution is actually putting social determinants and healthcare inequities into the mainstream of medical education, new companies, payment models, and clinical care. So that's basically when we decided to, quote, virtually get married. That was the prenup agreement that Hemant and I signed.
Hemant, there's always two sides to the meeting story here. Anything you want to alter or change?
Yeah, I want to get the analogy of us making a baby together out of people's heads. So let me take another shot at describing this. Look, I think the observation we had made in the healthcare space, because we've been investing in this area for a little while, was the companies were really siloed in their points of views. So either they were technologists that brought that typical disruptive mindset, saying, hey, we'll build some great piece of software and it's going to disrupt healthcare, or they were folks that were deeply entrenched in the existing system and they were in the weeds and they were not thinking about, well, how has the world changed with technology broadly and what can we bring here? So a lot of our approach, and I mean, you know this from Livongo, has been around how do we bring the interdisciplinary thinking around technology and healthcare together. And the thing that I distinctly remember about that dinner, where we tried to bring healthcare leaders together to say, hey, we're going down this path, we're going to take on this software and technology problem in this space, but we need help. We want the radical collaboration with the health systems. The thing that was interesting is, and I don't know if you remember this, Steve, for our dinner, everybody talked about the opportunities and problems they're focused on. These are leaders of serious health institutions. And at the end, they asked me what I thought. And I was like, look, I'm just struck by how little you actually talked about the customer. And in every other industry, we start with just understanding the personas and like, what are we going to do to transform their experiences? And that just wasn't going to happen unless you bring people together from both worlds. And, Steve naturally thinks that way. And it sort of just became clear that, our partnership could bring those two worlds together and just rethink the problems and opportunities in the space.
And Jennifer, we're not going to let you be Anderson Cooper here because you have a lot of stakes in this. I'd be interested in your thoughts around that whole consumer segmentation thing, because I think one of the things as Livongo's evolved and gotten together with Teladoc, you folks don't think as one patient. You really have been able to get out to very different kinds of patients. How did you start to do that? Because that's a challenge for those of us in the traditional healthcare ecosystem.
Yeah, I think so thanks for the question. I think a couple of things. One, I think we understood what Hemant said is we really focused on the end user, and we understood that because you have diabetes does not mean you care about all the other things other people with diabetes care about. We're all radically individual people, and so the more we could understand the actual person and what their journey and the condition meant to them, we could give them and meet their needs, right, and involve them in the process and the program by providing what they cared about. And I loved the phrase around understanding the end user. One of the things I was really proud about at Livongo is every conference we did, we started with members on stage. And we did that because that was key to our success, was just that obsession with the end user, for the audience, for our team to understand that. We made every employee call our members so they had direct interaction with what that living experience was like. And so that's I think, and that the way we did that is we had an underlying data infrastructure that collected that information and generated some personal information back to them.
Yeah, and I think that's a good lesson for us, at least those of us who run health systems, because I always laugh when I go into a town and I see a billboard and it says, Pleasantville General Hospital, we are patient-centered. And I think two things. Well, what hospitals aren't? And then the second thing I think is, are you patient-centered for a 67-year-old with an Oura Ring and an Apple Watch? Are you patient-centered for a 27-year-old disengaged person? Are you patient-centered for a 75-year-old with cancer that only uses Facebook to see her grandkids? I mean, and I think that we have to start to get into that game, and our marketing and communication teams have to get away from those 30-second TV commercial type mentalities.
One of the early examples in Livongo where this interdisciplinary thinking came to play was, I remember when we were designing the consumer experience, somebody made the comment, hey, there's 40 apps focusing on helping consumers manage, at that time, only diabetes as a chronic condition in the App Store. And every one of them was focused on how do we really engage the consumer in a deep way. And when you think about it from a consumer perspective, well, who really wants to go into an app to think about their disease 40 times a day, right? And so we actually came up with what now is widely used as the disengagement principle, which is, hey, if you're going to help consumers manage their chronic conditions, you want to help them disengage from that cognitive load as opposed to thinking about it more. And that should be part of the product design philosophy. So those are the kinds of things that just don't emerge unless you bring the two worlds together in technology and healthcare and think more comprehensively about the consumer experience.
You two are coming from different areas within healthcare with a shared mindset, and I've heard the term radical collaboration. And can you talk a little bit more about, or maybe give some examples of how that's actually played out moving forward?
Yeah, well, I can start out with Jefferson's philosophy. So Jefferson's philosophy, whenever we meet somebody, we sort of do the opposite of what I think is traditional for academic medical centers. We say, after that 15 minutes and we have that Match.com moment where we say, all right, I'd like to have a second date. And most people say, okay, what's a small thing we could do together to get to know each other? I always say, like, what would be the most, crazy, disruptive, positive thing that we could do together? An example I'll give for Jefferson is, we met the CEO of the number 3 fashion design university in the country. At that time, it was called Philadelphia University. And we were really getting excited about the whole concept of design of the human experience in healthcare. And they had a large architecture school and whatever. And, we had some little things we could do together. And, we left after a half hour. And my colleague, Steve Spinelli, who was the president of that university, I said, hey, why don't we just merge? Why date? Let's just get married. And we did. And, it was fascinating because both boards were like, wait, why are you getting together with a 196-year-old academic medical center? And Steve, why are you getting together with a fashion design university? It's been honestly one of the most successful things we've done here at Jefferson because we brought that kind of creative thinking into Jefferson. And we brought that kind of strategy, focus, and discipline we have in the healthcare system. And I think a lot of that culture change of being creative, nimble, and flexible, because we had that with Philadelphia University, is what made the relationship with General Catalyst, and you'd have to ask Kmart, but I think so different. When we started talking, he said, all right, yeah, well, I know what academic medical centers are like. I know that it's going to be, 6 months to get anything done. I know I'm going to get a 32-page legal document. And, once we prove, no, hey, let's shake hands and get it done and prove that it's good and figure out a way that it's good for Jefferson and we can maybe both take some risks and share some equity. It really did turn into a great partnership as GC grew and as we continue to grow on our innovation side.
I think one thing you'll see, that we both have our own sort of independent journeys around the need for this radical collaboration. Like for us, the technology investment role has changed from funding software companies that are frankly focused on just efficiency of human beings in their consumer daily lives and work lives to transforming core pillars of society, right? We're now not building software for doctors or teachers or supply chain managers in the venture capital ecosystem. We're actually building healthcare services and running banks and running online schools and the like. And that, if anything, by doing that in social media over the last dozen years, we've learned that you can't be bringing the engineering design principle of move fast and break things to these important transformations of these core pillars of society. So for us, radical collaboration, a lot of it is about making sure we work closely with the thought leaders that have a deep appreciation for these industries and why things are the way they are. So that when we talk about digital transformation, and we bring new solutions to market, we're not leading to unintended consequences, right? I mean, the unintended consequence of having a free framework like Facebook was something we dealt with, right? Practically brought our democracy to its needs, lots of echo chambers, lots of enhancement of bias. Well, what is that same design principle? What is it going to mean when you're building healthcare companies and education and finance companies? And we're trying to basically say, let's indict this word disruption and truly go partner with leaders that are in charge of these important industries and work together and figure out why things ought to be, how things ought to change, and why certain things ought to stay the same, because there's a core reason why they were created. There's a core reason why certain policies were created, and sort of understand the historical context there properly.
Yeah, and I think Jennifer, the radical part of the radical collaboration is that it typically wasn't the way that the managing principal of a VC company and the president of a university and CEO of a health system would work. And so when we had a problem, the first person I called was often, Hemant, are you doing something to solve this? So I'm sure everybody listening to this now has thought about what's been great about EMRs and what's really not been great about EMRs. And so we were talking about that, and GC was developing a company called Commure, which is basically allowing us to sort of have a single sign-on for different EMRs. And it was frankly a beautiful radical collaboration. Just about every week, we were in essence interning the leaders of Commure into what the real IT issues were at Jefferson. And then abracadabra, our latest merger is after a 2.5 year FTC look at is with an Einstein Health Network, a 3-hospital system that is all Cerner. And we just spent a lot of money to become a single Epic place. So all of a sudden, this went from philosophy to action, and the ability to do that. And then that led to, hey, why do we have a separate digital innovation and consumer experience team that's relatively small, I mean, maybe bigger than some others, when there's a few hundred software engineers over in my partner's place at Palo Alto. So I won't give the image of us having a baby, but we did create a company together called
Steve,
Tendo.
all your analogies go to babies, marriages, and
Steve's a gynecologist. It's in his training.
But we did start a company called Tendo, which really is that person bringing those two things together in some respect, and actually sitting on my cabinet. So, our head of Jefferson Health, Bruce Meyer, when he has a problem now, he has an opportunity to go and access all the resources of Tendo and in some cases of GC.
So this radical collaboration led to a physical production of a book that you jointly authored together. Although I would love to hear the story around who had the last edit, because I've learned that that's a really important piece before it goes to press. But so the title of the book is Unhealthcare, a Manifesto for Health Assurance. Can you tell us what health assurance is?
Yeah, health assurance to us means really two things. First and foremost, reorienting our healthcare system into a set of consumer experiences around the personas. So bring that customer mindset, that consumer experience and mindset to the center of how the care is delivered. The second thing, which I always have to pause and say as a venture capitalist, is we have an obligation to reduce the healthcare GDP. In every other industry, we're talking about increasing the size of the markets. Here, I feel like true health assurance, which is equitable and accessible to all, and is the right set of consumer experiences, is going to only happen when we literally shrink the size of the market. So everything we wrote about in that book was a set of design principles on how to transform our health system towards those two particular points.
Yeah, and I think what's really interesting about this, I was thinking about this the other day, Hemant, is that most of the time what happens is you write the book, you know what your thesis is, and then you spend a little bit of time, all right, let's come up with a title, or maybe even somebody else comes up with a title. If you remember, we started out in Palo Alto having coffee, and we spent a lot of time on the title. And so I think the manifesto was a really important word. I think we wanted to call it common sense, but I think Thomas Paine already had that. So the manifesto word was really important because we thought it really is a clarion call to action at this point. And remember, this started before COVID. And then we really spent time on the health assurance word. Because at Jefferson, we've been talking about, moving from a sick care model to healthcare at any address. Health assurance is really cool because it basically says, that people aren't interested in, 97% of people in Philadelphia, as you said, Jen, are not patients. They're people that want to be able to thrive without healthcare getting in the way. And we tend to treat them like patients. They want to be assured of their health. What do you say when you toast people? To your health. So the manifesto call to action and the health assurance. And then there was a little bit of a subliminal message, not negative, but we're not talking about health insurance. And chapter 5 is the end of health insurance as we know it, which is not negative about health insurance. It's negative about if all you're going to do is stay where you are, of being that middleman, then that's not going to move forward. If all I'm going to do is say I just have to make sure that when people come to my hospital, that's all I have to take care of. And the fact that we have huge healthcare inequities in Philadelphia is not my problem. And that's not going to work. And if all the new companies that come out of the digital transformation world are creating larger companies and helping people with commercial insurance, that's not going to help. So the concept of health assurance for all from a sick care model. So we probably spent as much time on the title. And then what we did was we actually, given that this once in a century thing happened, we actually infected the book with COVID. And, by that, I mean, we actually said, okay, let's go through the entire thing. And we delayed the book for about 4 or 5 months. We didn't just, superfluously put in some COVID references. We said, what have we really learned? And surprisingly, we'd actually predicted that a lot of the things that would need to happen have happened around telehealth and other things, but it actually accelerated. So we feel really good when it came out, that we were on the right side of history as far as recognizing what needed to happen in a very complex healthcare.
And there's your answer, Jenny. The last edit was from Steve, and it was a big one because we actually went through the entire book and tried to take the learnings of what they were dealing with at that time and sort of add that perspective into the book.
Yeah, and by infected with COVID, that does not mean that you cannot touch the book and only have to listen to it in audio. That was just injected. Yes, okay.
Thanks,
Amazon
Schneider.
would not be happy about that. I'm glad you clarified that up.
Hemant, how do you see the future of digitally enabled healthcare? So you've talked about, and I think been quoted around letting thousands of Livongos bloom. What do you mean by that?
Yeah, so look, with Livongo, you guys, proved that if you applied the health assurance principles, a lot of our thinking was guided by what you guys built. That's okay. A lot of the learnings around health assurance was in the context of the playbook that you guys built in building Livongo, and so the idea was, hey, if we can successfully build this interesting virtual health system that serves the 32 million plus consumers with chronic conditions, like starting with diabetes, well, that's the playbook. We got to do the same thing for different demographics and disease conditions, whether it's women's health, transgender care, musculoskeletal, mental health, and we got to think about each of those consumers and what's the delightful and health assurance centric experience we can design for them. And that leads you to thinking about, hey, in the future, you are going from this geographic center health system approach to a new model, which is going to be at the intersection of virtual and physical, where consumers will be able to access certain level of care that's designed for their persona online, much like the internet. And then that's also available when they have to go see the physicians to get actual care in person, this sort of seamless experience across that. So we have been, over the last couple of years, very intentionally building a set of companies that are focused on those consumer segments and are carefully thinking through the interplay of virtual and physical continuum for each of those segments.
And Jennifer, the first time I heard Hemant talk about that, I recognized, darn, I really have to think about what's the role of the human when all that happens. Not only what's the role of the human patient, but what's the role of the 35,000 humans that work in Jefferson, especially the physicians? Because at the end of the day, if you think about it, if so much more of this is continuous data and people are with wearables and Livongo and they're staying at home, and as you know, we were one of your first scientific studies on Livongo, then what is the role of the physician that's different, and how does that change how I choose students to become doctors? So, we still accept students based on science, GPA, MedCats, organic chemistry grades, and memorizing the Krebs cycle. And somehow we're amazed doctors aren't more empathetic, communicative, and creative. So we might be at one of those nexi where we're really starting to think about, hey, maybe it doesn't matter as much if you're not going to be a physician scientist, if you're going to be a family doctor, you're going to be an OBGYN, whether you're the quickest on the block to memorize the citric acid cycle. Maybe it matters more that you can listen, that you understand cultural differences, that you can explain something to somebody, that you can convince them to get a vaccine. I'd rather have a doctor that can convince a patient to get a vaccine and understand their hesitancy than somebody that can memorize the organic chemistry formula of the vaccine. So it's really created a whole different model for us as we think about a future where so much more of that care is going to happen at home.
Yeah, I just want to underscore, as a physician entrepreneur in digital healthcare, I probably have about 10 calls a week with people saying, hey, I'm a doc and I want to cross the chasm. How do I do it? And the learnings from having hired a number of people who were not great fits in this space is culturally, it is very different. So it's not hierarchical, it's team building. It's not kind of, this is the rule. It's trying to figure out a new creative experience and put the patient at the center and work with a team of people who are not trained in healthcare. As an attending, you have the last word because there's healthcare at stake. And in a creation environment, that's not necessarily true. It's weighing the trade-offs of experience with healthcare, being responsible, but understanding that you're creating something new.
Yeah, and Jen, it's funny you say that because when I went to Wharton, it was a weekend thing and 90s, and I was one of only 3 doctors at Wharton at that time. And I would go on the weekend and people would say, boy, you're so lucky to be a doctor. The whole world's changing, a $2 trillion industry going through all this change. What a great opportunity to think creatively and, just do some new things. I wish I was in healthcare today. So yeah, so Sunday night I felt really good. Monday morning I was in the OR listening to my colleague surgeon saying, oh, medicine is really lousy. I'm telling my kids not to go into healthcare. I wish it was the way it was 20 years ago. The same set of inputs, very different thoughts between entrepreneurs. And we actually did a study of the way we select and educate doctors. We've joined a cult around a competitive bias, an autonomy bias, a hierarchical bias, and in some respects, a non-creativity bias. So at Jefferson, we spent a lot of time really bringing out that creativity in all of our students. We actually have a requirement now that every student has to take at least 2 creativity courses. Our most popular one this year was beekeeping, for exactly that reason, to get them thinking differently as they start to go through their biochemistry and microbiology and cardiology rotations.
That's great. And I have kids who beekeep in the Montessori school, so they can come teach for you at any point. So Modern Healthcare has actually asked the 3 of us to talk about the Health Assurance Acquisition Corporation that we're all involved in, which is a SPAC. Clearly, that's illegal for us to do. But I am going to ask HT, maybe you can talk a little bit about what a SPAC is and why you were interested in creating this one.
Yeah, so a typical SPAC, Special Purpose Acquisition Corp, is essentially a public company that goes and finds a private business, merges into it, and then the whole thing becomes a public entity. And the creators or the promoters of a SPAC get paid effectively a broker's fee for enabling that deal. And so there's a industry-wide phenomenon where there's a few hundred SPACs that have been created that are becoming an alternate way for companies to go public. Our SPAC, which we actually renamed to a SAIL, Stakeholder-Aligned Initial Listing, was designed to bring a builder's mindset to this vehicle from a broker's mindset. So the way our sale works is essentially, if we combine with a private company and take them public, first of all, in this particular case, it's focused on health assurance. So it's a thesis that all 3 of us believe in, and it's something that a lot of entrepreneurs are looking for guidance on as they become public companies. So it's received a lot of interest from private company founders to think about that as a way to go public. And then the way the economics work of this particular vehicle is that there is no broker's fee up front. Our team, the three of us and the rest of the board in our firm, we end up participating in the value that we help create. So it's very aligned in terms of becoming builders alongside the founders and the management team of a company, aligned around the thesis, and then aligned around the economics as well. So
and Jen, the one thing that I would add to that, and I think we talked about Heyman's vision of creating 1,000 Livongos. I think what's really fantastic about it, what I really enjoyed, it's not just creating 1,000 Livongos for 1,000 Livongos' sakes. It's looking at that whole complex ecosystem of healthcare and where that new creative broker mindset can make a difference, and then filling in the gaps. So, you know, the fun part of the sale and the smart people like the two of you that are on it is that, you know, it's looking at, okay, so we have Livongo, we have this, and we have this, we have Comure, et cetera. You know, now what do we need? And I think that as we start to think about health assurance, we can really start to fill in the gaps. For Jefferson, I think what's really important is the recognition that we are somewhere in that Amazon moment. That was probably true before the pandemic. It's certainly true now. And that, as with any moment like that, when your industry is changing, you either latch on to the old way that you created revenue, which was, you know, in our case, hospital revenue, in-person tuition, and NIH dollars. For us, you know, we recognize that that old math was not going to get any better. And just like we saw in retail, that, you know, Macy's, Sears, and Penny said it's a fad, but others like Target and Walmart said, hey, I have to be in that part, but I'm darn good at what I do. And that's what we've said. You know, if somebody has pancreatic cancer, you know, they want to come to Jefferson, they want to come to our general acute care hospital. We feel we're among the best in the country for that. It doesn't matter how big the TV is. It doesn't necessarily matter exactly what our digital experience is. But for the other 97% of patients, we want that to not only be a way of differentiating Jefferson, so that when they do get sick, they're not going up and down the highway looking at who has the coolest billboard, but also, frankly, diversifying our portfolio. And this year, especially during COVID, where that old math became such a problem, our innovation and strategic partnerships portfolio actually did very, very, very well, and was actually probably our most profitable portfolio.
That's great. I'm going to end with one question for each of you. I'm going to start with Hemant. Hemant, you are known in the venture world as being a long-term partner, a strategic visionary, a builder. You have the Midas touch, having been named to the Midas list yet again this year. What advice do you have for entrepreneurs in the audience?
Yeah, I think I would say in this next phase of innovation, the idea that there's a choice between financial return and societal return in the kinds of companies we build is a false choice. I really do believe that most of where entrepreneurs are focused today, in order to win and build enduring companies, you truly have to build companies that are maximizing both, that are focused on creating companies that are fundamentally in the interest of society. I think that mindset will become more and more clear over the next 10 to 20 years as companies with that orientation show great success. And that'd be my one advice. Start with that alignment as a core design principle as you think about what to go tackle next.
I love it. And Steve, you are a well-admired, respected CEO of an academic medical center. What advice do you have for people in your position?
So I think what I would say is just never get bored. And, you know, I think what we found is that instead of talking about the things that you're doing well, you know, really look in the mirror and say, you know, what could I do better? You know, so I'm in Philadelphia. You know, we have 5 great academic medical centers. We changed our mission from being the premier academic medical center in Philadelphia, because nobody really cares about that, and I don't know if you're sure how you measure that, to we improve lives. And then what we said is, well, yeah, the reason we want to do is we improve lives because while we have 5 great academic medical centers, we have among the greatest discrepancy in life expectancy of any city in the country. So then we changed, you know, some of our incentives. 25% of my personal incentive is reducing some of those inequities. And what's cool about that is that then people actually start to think really creatively. And you start to, in a place like ours with 35,000 employees, get people really, really excited. We talked about radical collaboration. I talk a lot about radical communication. And we do that throughout the pandemic. We had by far the largest number of COVID patients in this city, over 11,000. We had among the lowest employee infectivity rate. But the big thing was, and we didn't furlough or lay off folks, biggest thing was keeping people excited. And that communication piece became clear. And we tried to, in the midst of all this, we would do playlists for folks and have them understand that when they went home, that this is what they could listen to and that kind of thing. So I think some of it is recognizing that innovation, creativity, fun literally has to start at the top. And you can't have a situation where your board is saying, we're all about innovation, we're all about creativity, we're all about diversity and community engagement and health equities, and then have the CEO totally get paid based on EBITDA, hospital census, et cetera. So I think that's where we started to think differently. And Jen, I'd like to put it back to you because look, you did Livongo. It's like being Bon Jovi and getting You Give Love a Bad Name as the first song. And so what do you do next? So, do you just do Livongo too, or do you have some really creative things in mind?
Well, you take a nap for about 6 months. You take a little bit of sleep. I'm joking, sort of joking, and then you come back and do it because I think, like both of you, there's so much ahead of us to be done, and it's such an exciting time in healthcare. And there's so much talent around the table and drive and desire to make the system better for all of us. Because at the end of the day, we all consume it, and it's going to service ourselves, our families, and people with across the ecosystem. We're building something that I think will touch as many lives as possible. I mean, that's the goal, is really to get to an equitable distribution of healthcare in an ecosystem where there's a lot of inefficiencies and a lot of improvement in experience. So stay tuned. There'll be an announcement at some point. I'm just not sure when.
All right, look forward to it. Thank you.
So with that, I want to say thank you to both of my friends, Hemant and Steve, for your words of wisdom, for all the work that you continue to do in the healthcare ecosystem, and to the fact that Steve was number 16 on the invite list of 15. So you were able to get to the prenuptial and the marriage. We'll put the baby making to the side and come out with a lot of collaboration.
Yeah, I beat all those other suitors. That's true.
That's right. And thank you very much to Modern Healthcare for the opportunity to have the discussion together. Thank you.
Perfect. Thank you.
Thank you.
Well, thank you. And now we have live the legendary Dr. Stephen Plasko.
How you doing?
Good. How are you? Good to see you again. We haven't been getting a lot of questions, so please put your questions in the questions panel. The good news is we have a great question from Sandra Van Treese, former CEO of BJC. And you can see it there in your panel.
Yeah.
Let me take that.
Yeah. So the question is, sort of, it is a great concept of letting 1,000 Livongos boom. How should an innovative company think about exploring a SPAC or a sale, and as Hemant called it, versus the more traditional angel investor Series A venture cap funding, and what are the critical success factors? I mean, I guess a bit of the problem is, at least what I found is, you've seen one SPAC, so a lot depends on what they're asking for. I think the difference, let's say, if you were considering, or we were considering, an innovative company on the health assurance acquisition SPAC, the difference that you get between a traditional angel investor is, literally, this is a very, very long-term piece. So the goal, whether it's the same thing with Livongo and Teladoc, Hemant and Jennifer and Glenn are going to be, on with this company for as long as they can. I think so. A lot of it depends on where you are in the maturation phase, obviously, and I think nowadays, with money being fairly fluid, it really gets down to where you can get the dollars. Given the choice, I think if you can get involved with a SPAC like ours, and I think there are several, and you get that expertise as well as the angel investment, that's a pretty good prescription. Whoever the health assurance acquisition corp SPAC chooses, by definition is going to move forward because we'll have done an exhaustive search, and you'll have folks like Glenn and Hemant and Jennifer, on the team.
Mm-hmm. Then there's been press recently about signs are emerging that retail investors might be having some second thoughts about SPAC. So what is your opinion on that, and what's your forecast for the future?
Well, look, I mean, I think Bitcoin is down by about 13,000 today, and like a week ago, cryptocurrency was going to take over the world and still might. So I think you have to start, Steve, with some facts. The fact is that the digital transformation of healthcare is not a fad. The fact that consumers are going to have their "I'm mad as hell" moment, I'm not going to take it anymore, is not a maybe. The fact that, while the pandemic didn't tell us anything we didn't know about the fragmented, expensive, and inequitable healthcare system, it sort of put it right out there in the front. And, the fourth fact is, at some point, social determinants, population health, and predictive analytics are going to move from being academic enterprises to really big companies and the mainstream of clinical care, payment models, and medical education. So I think that, while this might be, and I hate to use the word, but a bit of a bubble of, the only part that's really a bubble is, if I start a company tomorrow, given that I have a little bit of reputation, I put AI and digital in the title, I can get first round of funding, and there's some companies that have done that and have gone a lot further than that. I think what tends to happen when you have this kind of overheated excitement about money pouring in, at some point the money starts to become a little smarter, and I think that's what you'll see. I mean, the everybody and their brother or sister having a SPAC and just assuming that was going to become a lottery ticket was ridiculous. So I think you'll see less SPACs. I think you'll see more of, again, I think Hemant explained pretty well how he views the difference between a SPAC and his stakeholder aligned, what he called a sale, as Hemant would say, my job is I sell money. And, it's not hard for Hemant to get the dollars and get the expertise. And, I think somebody investing in HAACU is looking and saying, wow, it didn't take them long, to get those several $100 million. And they can look at the board and look at the model of this SPAC or sale and say, all right, so whoever they pick, it's going to be another Livongo because Hemant's got the connections, he's got the people, and he's got the money. So I think, it's like a lot of other things. You have to look at, how is the SPAC funded? What is their mission? What's the track record of the people that are on the board of that SPAC? What other things have they done? Without betraying anything about our sale or SPAC, I think Hemant put it very well. Our goal is to start to fill in some of the gaps. Look, Livongo was a great opportunity to start to think about patients not as patients but as people. Mm-hmm. And so they said, we did that for diabetes. So one option is to look at other things in other areas like cardiovascular disease, et cetera. But the other one is to do what doesn't exist in either the GC sphere or whatever. So if you look at GC's companies or the companies they've been involved with, they have a telehealth platform with Teladoc. They have Livongo. They brought in InTouch Health. They've got a behavioral health company called MindStrong. They've developed Commure, which is a fire layer. So you start to think about, if you were creating this whole ecosystem, what's missing. And to me, SPACs that are willing to look at it that way as opposed to getting a quick hit, I think are the ones probably worth investing in.
So we don't have time for many more questions, but I see your books behind you there. So I don't see the Bless This Mess book.
Oh, well, it's here.
So you must have.
It's actually my favorite book, Steve.
That is a great book.
It's Bless This Mess, a picture story of healthcare in America. Warning, this is not a children's story. It's scary. Mm-hmm. Do not read it at bedtime unless you have a Cadillac insurance plan and can legally obtain non-generic sleep aids.
What are the two new ones? that were mentioned during this presentation?
Well, we have Patient No Longer, which I wrote with Ryan Donahue, Why Healthcare Must Deliver the Care Experience That Consumers Want and Expect. It's a much more serious book, no cartoons, no animation, but it basically, National Research Corporation, is actually the group that originally did that Through the Patient's Eyes. And, I would advise any of the listeners, really great series to look at, Through the Patient's Eyes. What it did was they put a camera while a patient was in a hospital bed from how she was seeing things, and wow. It got that was one of, and this is like 30 years ago. Some of the initial work, Steve, about if you sit down with a patient, if you're a doctor or a nurse and you sit down with a patient, they'll think that you were there about 5 times longer than if you stand up. Probably because you stand up, they're looking at your butt or your crotch, whereas here they're looking at your eyes. So this is taking that a step further and say, they've done a fair amount of research on what patients want and expect, and then are looking at the gap. And so it gave me a chance to bring in some of Jefferson's healthcare at any address model into this what patients want and expect. Look, I think that if I was starting a company now, that thing that we talked about around consumer segmentation, I think is really an awesome opportunity for us to really make a difference. Because this whole concept of having a billboard that says, "I am Pleasantville General Hospital. We are patient-centered." What does that mean for a person with an Oura Ring and an Apple Watch, or a 26-year-old disconnected person, or a 75-year-old with cancer, right? So we've talked about this, but Amazon has 2 million of our types, and we say we're patient-centered. So I think that's going to be the next big revolution in healthcare of, how do I get to different types of patients and get them what they need? And I think starting to see some things come out of that. But if I was starting a SPAC, that would be the kind of companies I'd look for.
Well, that was going to be my next question. What do you think's on the horizon for healthcare, and what's on the horizon for Jefferson right now? Well, you're getting the trends there,
Yeah. So I'll start with Jefferson. When I got here in 2013, we were a two hospital, 3,500 student health science university with 3 boards, about $1 billion in revenue. By the end of this calendar year, we'll be an 18 hospital, 2 campus university with a 196-year-old medical school and the number 3 fashion design university in the country, literally with an MD master's in design of the design of the human experience, and a $2 billion insurance company. So we're very different. But the biggest change that's going on is our 4-pillar model. Academic and clinical being the old math, Steve. Innovation, strategic partnerships being the new math. And, as I said, during our interview, for this year, those partnerships, those investments in Comure and Tendo and American Well and things like Ambulance made a lot more money than my 14 hospitals. So, wow. The one advice I have for folks that are in my position, please don't go to HIMSS and have, the 897 24-year-olds tell you how they're going to transform healthcare if you buy their product. I think so. One of the trends I think you'll see that we're getting part of is creating innovation super sites without giving the names of the places. And some of this is working with Heyman and others is, we're looking at 4 or 5 like-minded places like ours that would in essence take our innovation pieces and in some respects create joint ventures there. So if anybody out here has a company, instead of just coming to Jefferson, they're coming and presenting to those 5 companies. Right? It's almost like five health systems. It's almost like a Shark Tank. I think what I'm starting to see in the companies that I'm on the board of, and probably the best example is on the women's health side. As an obstetrician, it's something I've gotten very involved in. So I'm on the board of a company called Nuvo, which is doing remote obstetric monitoring, right? So instead of having to go to the hospital 3 times a week to get non-stress tests, my daughter got pregnant, this year, and she had to go to the hospital 3 times a week to get non-stress tests. She said, "Hey, dude, you're like the digital guru. Like, why do I have to pay $35 to park and go to a place where there's a lot of sick people to have somebody? Can't I do that at home?" So I look at Nuvo and I say, okay, that's a great company. Then the question becomes, we're also working with a company called UVA, which is actually looking at doing that for infertility. Then there's companies like Kayaba that are looking at the pregnancy thing for first, second, and third trimester. And there's a company like Oath that's looking at it for postpartum. So the question becomes, again, if I could be that sort of Match.com, I'd say, wouldn't your value all go up if you could create a cross-pregnancy experience from infertility to getting pregnant, maybe a Match.com between obstetricians and patients through the first 3 trimesters, if you need monitoring at home, and then postpartum? That would be more than 5x value. That would be, somebody being able to go and say, oh, I can conquer women's health. So I think what I see as the biggest trend now is some of the defragmentation of some of these apps. Livongo and Teladoc, I think the signal that they've sent is we don't want to be a telehealth company because telehealth is going to be a commodity, right? And I think we've seen that with Amazon, even since we did that recording. Amazon came in, and all the telehealth stocks tagged, American Well, Teladoc, right? What they want to be, just like Google said, I don't want to be a search company. I want to be the first place you go to on your computer. What Teladoc is saying, I want to be the chronic disease management company. Well, that means they're going to have to get together with other folks to do that kind of stuff. So I think that's going to be the next phase in the digitalization, that instead of just creating this app, you'll see a lot of startups start to get together horizontally, whether it's in women's health or orthopedics or cardiovascular or certainly diabetes.
Well, I have to get our participants out to the next session here, but I have one final question. Do you know what was Bon Jovi's first hit?
Oh, I really, this is really especially hurtful because I pride myself on not on my medical or entrepreneurial.
You'll never know it.
My DJ. What was his first hit? It was
Runaway.
Oh, that's right. The Del Shannon song, right?
Yeah, which makes your point. Like no one knows that, so I guess it's a good thing. To give Love a Bad Name wasn't their first hit.
No, that he actually, I believe he did that when he got into the Hall of Fame. That was one of the songs he did. It's probably, I didn't realize his first song, but
I don't know if it was the Del Shannon version, but I just looked it up just to.
Okay. I think it was. Well, we can fact check that.
Okay. Well, thank you very much for joining us today, and to our audience, thank you for your questions. And our next session, we're actually a little late for, so I'll let you all go. Thank you, Dr. Klasko. It's been a pleasure speaking with you. And to all of our attendees, get to the next session and have a great rest of your conference.
Thanks, Steve. It was a lot of fun. Take care.
Thank you.
Bye-bye.